Hello, Mingjie students. We're back. Okay, so something that I want to bring up here that's kind of interesting is that even though I've been saying, okay, at some time in the future somewhere, we're going to be studying these classical formula ideas, I want to bring up that actually in studying the combinations in the way that we're doing them, we actually are studying the classical combination ideas. And what I'm doing is I'm illustrating them for you with each one of these. Now, we might not be talking about particular formulas, but what'll happen is that after we study in this way and after you learn in this way, at some point you'll be studying the formulas themselves, the classical formulas themselves, and you're going to go like, oh my God, that's what John was talking about. That's what he meant when he was talking about that, because you'll see that combination will appear, or something very similar to that combination will appear. Okay, like in that example that we were that John Maxwell brought up. With that formula, we can see what they're doing. We can see what they're doing, what the idea is, but maybe we don't want to be so extreme. School, whatever that school that invented that, maybe we want to be a little bit more conservative in our approach, like that. It pays to be conservative with a lot of things, huh? And even though from the outside, this is kind of the paradox of that, from the outside, what we're doing might look totally radical to someone who's practicing maybe, say, sort of your run-of-the-mill TCM herbology. It looks totally radical, but from us, we're doing something actually that's very conservative, and we can prove it by the logic that we're using, which may be quite unlike what they're doing. So always keep that in mind, okay? So let's get back to sharing the screen. Okay, so, okay, we did Shishin a long time ago. I think you'll agree, you guys, this is getting more and more interesting as we can go deeper in, and we're starting to understand a little bit more of the logic of what we're doing, so we don't have to spend so much time on the structure. Initially, we were learning the structure, right? So now we don't need to trip out on the structure so much, because that's what we were learning to begin with. But what we can do now is we can appreciate a little bit more of the flavor of what the herbs themselves are bringing to the structure. And that's really what it's all about, right? It's like when you go and you start studying Shaolin. You start studying Shaolin. I did that with my daughter for 5 years until COVID drove the monks back home. So initially, when you're learning a Shaolin, you have to learn all these different forms, okay? And you're focused on the forms. And then initially, you're just trying to remember all the different moves that you have to do. It's like this horrible puzzle that you have to do, you know, going through all these different Shaolin forms, huh? But that builds your neurology in a certain way. And once you get to a point where, at a certain point, you don't have to think about what the next move is going to be because it's been ingrained in your unconscious, then you can start focusing on how you do the move. So that's exactly what we're doing here, right? So now we're ingraining the structure. So we don't have to like really focus that much on the structure because we understand what it is. And now we can start like learning how are we going to move within that structure. So that's what we're doing, okay? All right, so we're switching gears. And we're talking now about some fire that's going rampant from the lungs all the way down into the UB, causing fever and delirium, okay? So it's a situation with a fire that started in the lungs, okay? And it's just rampaging through and going all the way down into the UB. This is something that happens more frequently than you would imagine. You know, a lot of times people they do wind up after getting like a wind heat or a wind cold situation, they do wind up having urinary problems afterward because it was not properly treated. Also, the same thing happens. I know I'm always frequently hammering on the COVID vaccines, but it's something that we're all having to deal with. Something that happens very, very frequently after people get these COVID vaccines. The women, anyway, after they get the COVID vaccines, within a few days, they have what appears to be a bladder infection. I think I mentioned this before. They get what appears to be a bladder infection, right? But when they test, The test says that there's no bladder infection, but they have all the symptoms. So what's going on? It's a blood stagnation that's happening down in the UB channel from it's a combination of blood and toxin, actually, that's getting stuck down there in the UB. It's the body trying to get rid of those weird shaped spike proteins and whatever else is in those vaccines. The body's trying to get rid of it, gets stuck in that area. Also, we have a lot of women who wind up having these very, very strange reproductive problems that come up, these strange infections that cannot be diagnosed after getting those vaccinations. So that's an interesting phenomenon that we have to learn how to work with. If we can help people with these post-vaccination syndromes, it's a really, really important thing to focus on. I wouldn't advertise that that's what you're doing because of the current political environment, but if you can help those people, it's really, really valuable because nobody else seems to be able to help them at all. So anyway, that is my my suggestion to you, because we have to really focus on, you know, what is it that we can really treat and help people the most with, and find what's unique about our medicine. There's no point in just treating people just to treat them. Okay, especially, you know, if Western medicine can treat certain things better, we want to look for what the best treatment is. Okay, so if there are certain things that we can treat that nobody else can treat, that's a great place for us to focus, because that's a real strength where people would be suffering otherwise. And what are we trying to do? We're trying to relieve and alleviate suffering. That's the whole idea. Okay, like that. So it should give us pleasure to relieve the suffering of others, and that will relieve our suffering as well. That's a sort of a Buddhist perspective of what we're up to. Okay. All right. So fire is going rampant from the lungs all the way down into the UB, and it's causing fever and delirium. All right. So here's an interesting combination. It's not such a freaky combination like some of the other things that we've been doing, but here we go. We might even say this is kind of a classical combination to do something like this, because I could imagine we could find many practitioners doing something like this. Huangbai plus the Xigua, right? The watermelon. Sweet and cold. So we're combining bitter and cold with sweet and cold. Okay, so it's the sweetness might mitigate to the point of neutralizing some of that bitterness, huh? But again, we could adjust this with dosage, huh? But look, this is quite interesting. Remember, again, we're optimizing for the kidney, so we're looking for these channels that are off of our kidney line on our chart. Okay. The only thing we're stacking here is the UB, but we've got an amazing synergy here between the large intestine and the stomach, don't we? All right. We've got a double UB connection, that clock opposite connection between the lung and the UB. Okay. The heart goes with the kidney quite well as well. So this is very integrated. Is it a formula? Let's take a look. It is a formula. Look at there. It is a formula because we have both hand, yin and yang, and foot, yin and yang channels that are involved. So that's cool. Look no further. Huangbai plus Xigua to treat this. So what else could we use it for? I just really like this. We could use it for, I like it again because we're pulling the Yang Ming in here, right? Very tidy integrations here in this formula invoke that Yang Ming to help take care of the heat. Okay, so the body naturally does that. Remember, that's what the Yang Ming level is, dealing with heat. The Yang Ming is not just the large intestine and the stomach channels, right? But it's a level of disease. It's considered to be a level of disease, which also we can do with our balance relationships as well. And we're going to get into that more in our level 3 classes. Okay, using them, our relationships for diagnostic purposes, because every relationship is a level of disease if we know how to use it properly. Okay, so we're going to go deeper into what we already know again and again and again. Okay, so this Huangbai Xigua idea This is the kind of situation that can happen when practitioners use generic wind-cold formulas for their patients, okay? And they just transform what would have been a benign illness into raging heat scenario. Okay, so this is classic. Oh, this patient has wind heat, and so, or wind cold, and so they give them a formula that's generic and not really so appropriate for the patient themselves. It's all they do. The good news is they transformed the wind cold, right? But the problem is that they transformed it into a wind heat that is then turning into some kind of rampaging heat that's heading down into their UB. Oops. Okay. All right. So we already, what else could we add here? We already talked about Schanzerger back there when we were talking about the Sanjiao, right? But let's look at Schanzerger from a heart perspective. Again, we're looking for synergists with respect to the kidney here. Okay, so Huangbai plus Schanzerger from the perspective of the heart, optimizing for the kidney. Okay, so looking at Schanzerger from a heart perspective, looks pretty random actually, and useless actually in terms of synergies. Okay, but remember again, like we discovered before, that the stomach, the Sanjiao, and the liver make it look pretty good from a pericardium perspective. All right, and the heart, lung, and the stomach, and the Sanjiao make it look fantastic from a spleen perspective. Look at that. Okay, we've got heart, lung, stomach, and Sanjiao. That's 4. Okay, that's fantastic from a spleen's perspective. So whenever we evaluate an herb's qualities and potentials, we always want to ask from what perspective. Okay, that's part of the idea that I'm giving you here with what we're doing. So from the perspective of the kidney, when we distil in the pericardium, Schanzerger actually looks pretty good after all. But when we look at it from spleen, wow, there's all kinds of possibilities, huh? So here's our formula, or is it a formula? Let's see. We got lung, intestine. Yeah, this is a formula. Sure, why not? Okay. Okay, so here we cover actually the entire kidney balance network. All right, plus the lung. Okay, it's bitter and cold. Bitter and cold are both double stacked. Okay, my computer is telling me to absolutely remind everybody that tomorrow is Indigenous Peoples Day. Okay, so let's all remember that. A very important day. Okay. Let's see, Huangbai and Schanzerger. Okay, so we've got that whole kidney, all these kidney channels, all this kidney territory has been covered remarkably. Okay, kidney, yes. UB, yes. Large intestine, yes. Heart, yes. Sanjiao, yes. Large intestine, yes. Okay, pericardium, we ghosted in or we distilled in, right? So then we have the stomach as a dangler there. So stomach is the dangler, and the liver is not such a dangler, but it's not directly involved with our kidney optimization, but we do know that it's going to combine well with the large intestine, okay, as the stomach does. There's a little bit more of a large intestine function going on here because of the power of these synergies working together. So that's important to keep in mind, to look where's the structure of the formula, where the structure of the internal synergy is going to lead us to. Okay. Okay, and again, that's analyzing that structure is a part of what gives us our idea of what the guiding principle is versus a single guiding herb. All right, which is more powerful, to try and have one messianic guiding herb to drag everything, or if all the herbs actually kind of want to go there on their own, if they got together in the right group. That's what our Ming Che medicine is all about. Okay, so we covered the entire kidney balance network plus lung, okay, and the liver. Okay, we also stacked bitter and cold, didn't we? Stack bitter and cold, stack bitter and cold. Okay, so we got that kind of a stack going on. What else do we have stacked here? Nothing else stacked, okay, but we did stack bitter and cold. Yeah, but we got lots of really cool synergies going on there, okay? Very strong formula for clearing heat, fire, and dampness from the whole kidney system. That's super useful, okay? And so you have this very simple, very strong formula for clearing heat, fire, and dampness from the whole kidney system, and it's using the entire kidney balance network with 2 herbs. That is a miracle that we can do that. I think it's awesome, all right? That's the kind of thing that I find very exciting with what we're doing. It's like, oh my God, look at how these things fit together and look what it's perfect for. And sure enough, you try it clinically, it is perfect for it, okay? Not just an idea, but this plays out in clinical fact, okay? All right, so remember, if we want to cold down a formula more and generate a lot of fresh fluids and drain old fluids, which is an important quality, Shiguapi is a very good herb for doing that. That's the watermelon rinds, okay? Again, it's a very Taoist thing to want to use what others throw away. Shiguapi, watermelon rinds, okay? It's sweet, it's cold. Interesting channel tropisms here, okay? So we could use it for a variety of different situations. Might not perfectly synergize with anything without having some danglers, kind of no matter what system we're looking at there, right? But it is very good, that sweet coldness, it's very good for making a formula get more cold if we want that, okay? And it's also very good for generating fresh fluids and draining out old fluids, okay? Because again, the Shiguapi, it has a certain bland quality, like all those, we were talking yesterday with those giant citron rinds, that white part there, it's got a lot of bland to it. So any of those bland, or any of those white middle section, whatever that spongy stuff is called, that's got a lot of bland quality. So it's going to be draining fluids out, old fluids out. And Shiguapi is cool because it's not just draining old fluids, but it is also generating fresh fluids, which we also want, especially if there's a lot of heat going on like this, right? Okay, so we could also add so this situation, say Huangbai Shanzhizhi, it's getting more extreme, there's more extreme heat going on. Okay, so we just put some Shiguapi in there just because we want to make it colder and generate more fluids. Perfectly fine to do that. At least we have UB synergy, and we also have heart synergy going on there too. So both of those are right in line with our kidney optimization for now, okay? So we could also add something like, we just visited this a little bit earlier. So to jog our memories, let's bring it up again. That Lianzi Xin, we can bring that up again, right? Okay. So we can clear more heat, even purge some fire with bitterness and some of this astringency. This is the cleaning kind of astringency. But maybe this fire is getting so extreme that the fire is just like burning out the person's chi, all right? So we're reining it in just a tiny bit, okay? All right? So we could use that for when toxic fires begin to really impinge on the heart and the pericardium, okay? So we've sort of done that from both sides now, okay. If the kidney functions can't keep up with discharging wet heat, kidney functions can't keep up with discharging wet heat, we're going to come back to John Minnie's favorite and John Minnie's patient's least favorite herb, Kushen. Again, if the kidney functions can't keep up with discharging that wet heat, we can put some Kushen in there and look at all of those kidney optimizations. We're really treating the kidney here. Look at this. Very, very, very strong. okay? And even that small intestine is synergizing with the UB quite nicely, okay? And this large intestine is gonna combine with the stomach here, so we're gonna be yang minging some of that heat out as well. And the liver is gonna combine with both the small intestine and the large intestine, so there could be some kind of liver heat that's involved with this as well. No problem, okay? So the stomach is supporting the large intestine and small intestine supports the UB, okay? So Kushen is really cleaning this heat and toxin out through both door number 1 and door number 2, okay? Especially with the Huangbai. Okay, so we have both door number 1 and door number 2 as the exit points for that heat. Okay. And when we add, the Huangbai, Kushen, the Huangbai. Okay, here we go. Okay, so we were talking about classical formulas a little bit. Let's take this one on a bit. Okay, let's just use an extreme herb just to give us an example. Okay, this is the one we've been talking about a few different times in a few different ways. Let's go back to Huang Lian. Huang Bai plus Huang Lian gives us 2/3 of what classical formula? Let's see, where's our chat? Hello, you guys who love classical formulas. Huang Bai plus Huang Lian gives us 2/3 of the San Huang. Yes, very good, Lisa. And it's not Huang Jie Du Tang. No, it's not going to be 2/3 of it, but it's going to be a good part of it. Okay, so Huang Bai plus Huang Lian. Okay, this is our broad spectrum antibiotic formula. Okay, like that. This is a broad spectrum antibiotic formula. But again, this is going to be pretty strong. It's going to be very strong, but there's a lot of kidney action in here, isn't there? And even quite a lot of spinal action here between the DU and the UB. Like that, huh? Again, we've got some Yangming heat clearing here as well, like that. And then if we do the full San Huang, and we add the Huang Qin, then we pull the gallbladder in as well. And I think we double up on the heart as well. Okay, so like that. That's our broad spectrum antibiotic formula. Again, only use it for an extreme situation, or maybe you can use just a little bit of the Huang Lian if you want to include, so if you want to cool that heart down a little bit, maybe, huh? Or if we want to double up with this large intestine stack here, if the large intestine is more affected by that heat. Okay. So here's another combination we visited a little bit earlier. But again, we're going to look at it from a little bit different perspective here. Sorry. Okay, so it's Huang Bai plus a Danpi. Really, really good combination for the kidney, cleaning the kidney, okay? Especially if there's any heart, pericardium, any kind of blood involvement with this kidney heat that's going on, okay? Looks very good from the kidney perspective. It's such a great formula for cleaning and clearing heat from the kidney system and cooling and moving blood, which we frequently need to do, all right? So, we could cool the blood even further if we're going to go down these lines. Let's say we want to focus on this heart-kidney name relationship, which would be that Shaoyin relationship. And we can cool the blood even further if we want to by adding an herb. You might be surprised I don't talk about it too often, is the shengdi. I talk about it sometimes. So we add the shengdi. Look what we're doing. We're stacking that heart and the kidney. And look what happens here. We've got a liver pericardium synergy going on. So this is a very strong synergy going on between the Huangbai, the Danpi, and the Shengdi like this, huh? Very, very strong. So we have the kidney with the UB up here. We got the large intestine, the liver here, also with the kidney here, and internally with the Huangbai. Pericardium plus the liver. Okay, so we got that Jueyin taken care of. We've got that large intestine combining in various ways. This is really Jueyin and Shaoyin together. Very, very, very interesting, huh? Okay, so that's going to help to this combination here. This combination, yes, well, large intestine of the heart. No, we can say it's a formula, right? We can say it's a formula because it trusses out. So it's going to clean heat, generate fluids, and support and cool the blood. Okay, it's also going to move the blood. Okay, support, cool, and move the blood. This is quite nice here. Quite nice. Okay. What if the kidney fire is coming up into the throat? This is something that we see happen a lot. Okay, kidney fire comes up into the throat. This is a terrific herb that I want you guys using for sure. It's good for so many things, but in this context, it's good for this. Huangbai plus the Shandogun. Okay, Shandogun. Really, really good clear heat, clean toxin herbs. Okay, look at that. All of these channels actually converge in the throat with a double stack in the large intestine department here as well. Okay. So we got a double stack here with large intestine, huh? Heart goes up through the throat, stomach goes up through the throat, lung goes up through the throat. UB has some connection, right? Kidney definitely does. Okay, remember that one of those branches of the UB goes down into the root of the tongue, which is sort of the most upper part of the throat. Okay, so this is a great combination for hot toxin that's a hot toxin that is affecting the tongue. Okay, hot toxin that's affecting the tongue. I would use this combination. Very, very good. Clearing, heating, cleaning toxin. What else do I want to say about this? So if there's any wet congestion in these areas also, so this could be any kind of lumps that are in this area, that wetness congesting. Okay, you might want to even throw in some danpi there in that situation if those lumps are accumulating, or throw in something like jiebeimu to help to reduce those lumps, and if there's a phlegmy quality to that dampness. So remember, whenever you have the heat happening and the wetness happening at the same time, the danger is that that heat is going to bake those fluids down and turn it into phlegm. If you continue baking the phlegm, it turns into a nodule. Who wants that? Okay, so you can begin to clean it out. Shandogun is so good for cleaning these different accumulations, especially if they're getting toxic in the throat. That's why Shandogun is used for throat cancers all the time. Okay, so I just told you sort of the mechanisms of how that works. All right. Okay. And also for the hot toxin affecting the tongue, which is difficult to say, paradoxically. Okay. All right. So you could stack up those same tropisms, or at least very, very similar ones, with another very common herb, okay, which we would quite possibly be wanting to use in this situation if there's all this toxic heat going on. And that is one of the most common herbs of all, is the Jinyan Hua. Again, let's not forget about these very common herbs, okay, like Jinyan Hua. They're so useful. Okay, look at here. This is really interesting. Jinyan Hua and the Shandogun, look at how similar they are. Lung, stomach, large intestine, heart. Lung, stomach, large intestine, heart. Even in the same order. So this is another level of coherency. This is another level of stacking that if you really, really want to get into the stacking, you can use this in a variety of ways. Okay, so these stack up in the same way. you could, so that's going to create something that's stronger for the lung, a little bit less strong for the stomach, a little bit less strong for the large intestine, a little bit less strong for the heart. Sometimes you want to do it, then kind of do a taper like that, right? Or you could combine Shandogun or Jinyinhua with another herb that might go through all the same channels, but in a different order, and that would create a more even balance of those channels, okay? So you got to look at, it's almost like when we're making these formulas, we're loading people onto a small boat, okay? Not quite a canoe, right? So maybe like, yeah, a small boat, okay? So you get somebody into one side and then we have to get them on the other side, okay? So we have to balance out all the weight, right? Or if we have maybe like some heavier people, we don't want them all sitting on the left side, or else the boat's gonna go floop, it's gonna go flipping, right? So it's the same kind of thing. We literally need to balance our formulas in a way, just like we're loading people onto a boat. So imagine that your formula is a boat and that each one of your herbs in the formula is a person that's on the boat, okay? Like that, okay? So, but again, we don't want to get hung up in the balance idea in terms of temperature and things like that, because we have to think also that boat is heading into the patient. So that patient is going to have their own sort of angle. So even if sometimes if the formula is tilted to one side, we have to look at the environment that the formula is going to be used in, and that's where the real balance is. Okay. Anyway, you get the idea. So Jinyinhua and Shandogun are super similar, but Shandogun is more bitter, much more bitter, okay, whereas Jinyinhua is sweet, so it's generating more fluids, okay, but they're both cold. Also, Shandogun is slightly toxic. So because it's slightly toxic, it's going to be using toxin to fight toxin. So you're going to use it for something that's more serious level of clearing heat and clean toxin than you would with Jinyinhua. So Jinyinhua would be something that's like, it's some irritating heat. It's some irritating heat that could use some fluid generation like that, okay? Whereas the Shandogun is going to be more toxic heat that you have to really go to town and kick it out, okay? Makes sense. Even though they cover the same territory, okay? On one level, you're sending in like Mickey and Minnie Mouse, and the other level, you're sending in Rambo, okay? Like that, okay? We'll do like that. So, but you could use them together, which would be makes kind of a funny picture. All right, so if you add the Jinyinhua, that'll add some support and it'll begin to generate fluids, okay? So it's gonna further cool and lubricate that kind of a situation, okay? Now, what about for deficiency heat that's coming up and flaring up into the throat? That's gonna be, we're gonna treat that a little bit differently. For deficiency heat that's doing that, we would wanna use something like, again, optimizing the kidney, we're focusing on the kidney. We would use Hu Huang Lian, right? Good choice. Okay, it's clearing deficient heat. It's also cooling the blood a lot. It's bitter. It's a little bit astringing. And this is the kind of astringing that cleans heat even more, right? It's also cold. Whoops, we got to take the Shandogun out. I'm sorry. There we go. Huang Bai and Hu Huang Lian. Sorry about that. So we got some good kidney synergies going on here as we're optimizing for the kidney still. So we got kidney, okay, up here, kidney in the UB. Now it doesn't appear as if we have any extra sort of kidney-ish stuff with the Hu Huang Lian, but the heart and the large intestine definitely throws us into that category, doesn't it? Absolutely. Why? Because heart and large intestine are on our kidney optimization line. That's how it works, okay? Okay, and here comes another one of our Huang formulas. We get 2/3 of another Huang formula here that focuses more on door number 2. Door number 2, you should think immediately, Da Huang. Huang Bai plus Da Huang, what's that going to give us? Look how these stack up, okay? Strong focus on clearing wet heat through door number 2. Absolutely, okay? A lot of, so we got Yang Ming, okay? And the stomach is also supported by the spleen, and so is the heart supported by the spleen there, okay? Liver's got something to do with that large intestine, okay? The UB is supported by the DO here for sure. So we could use this Huang Bai Da Huang combination for a few different things, depending on the amount of Da Huang we use. If we wanted to use a lot of the Da Huang, then and we'd really emphasize that that door number 2, okay? If we didn't use so much of the Da Huang, just maybe a little bit as a kind of an activator isn't quite the right word because it doesn't have the acridity, but if we just use a little bit to bring some of the function, to help to guide a little bit of some of the functions to relieving that heart heat or even liver heat, like that, then we could talk about it in that way, not so much door number 2. But there's a lot we could do with this formula to relieve heat that would be vexing the heart. Okay, maybe you had to do something very quickly. You might even want to use more Da Huang just for like a day or something, to just get that stuff descending, okay? If the heat was impinging on the heart, all right? If we have a more of a Yang Ming situation where the large intestine is involved, presumably that would be a diarrhea situation, then you use a little bit of Da Huang, because remember, a very small amount of Da Huang doesn't really affect the large intestine that much, okay? But if you use a small amount of Da Huang, it actually will tend to constipate, okay, rather than purge. So you want to keep that in mind as well. So if you want to purge, you use a lot of Da Huang. If you want to help to plug things up a little bit, then use a small amount of Da Huang, and that's what it does. It's good to be told that versus putting your patient through that, because I know a lot of practitioners go through that and say, oh, well, I put Da Huang in the formula to move the stool. And I say, well, how much? And, oh, I just used a little bit because they were deficient. Well, guess what? It just constipated them. Okay, so we want to be careful with that function. All right. Okay, here's another really curious but really effective formula. Again, switching gears here, learning how to be flexible with our use of Huang Bai. Okay, Huang Bai plus Hai Feng Teng, right? Huang Bai plus the Hai Feng Teng. Look at this, okay? Strong kidney associations, plus we're bringing in the heart here, okay? So this is a really interesting formula, and it is a formula, but kind of a curious one, which doesn't bring us directly, well, it actually does. It brings us directly into kidney land, doesn't it? Large intestine, the heart, the kidney, plus the UB. That's pure kidney formula, huh? Very, very interesting, huh? Like that. Plus, we've got that extra liver tropism, which is somewhat synergized. It's not a pure extra liver tropism in this context. It would be if we just had the Hai Feng Teng there, but it combines with the large intestine very nicely. Okay, so we could moderate this formula. One thing that's interesting, right? So we're going from bitter and cold to acrid, bitter, and slightly warm. We could moderate this formula from being cold to slightly warm, and anywhere in between, okay? So we can treat B syndromes everywhere from the feet and ankles all the way to the throat, nose, and even the eyes with this formula. Look how flexible it is. And look, see, because it's got all these kidney tropisms. Okay, right, and because we have the kidney plus the UB, we're opening up those lull in the feet and the ankles. So you would think we would be able to clean and dispel wind dampness, open channels, and low network vessels, and relieve pain in those areas very, very strongly, okay, with this combination of Huang Bai and Hai Feng Teng. Okay, so this is a good example where we're cooling down just a slightly warm herb. We're cooling it down with the Huang Bai, okay? And we're going to be drying a lot. So we'd be looking for, this would be something, condition that would have swelling as well, okay? It's going to be good for dispelling that, okay? So again, we can go from the feet and the ankles for sure because of those low, all the way up into the throat. Why? Because we have the large intestine plus the kidney, plus the liver going in the throat, plus the heart going through the throat, plus the kidney. They don't say that it goes through the throat, but it kind of has to because we think that it ends up around here in the chest, but then it goes up into the tongue. So how's it going to get up into the tongue, but except for going through the throat? So it's going through the throat as well, okay? The nose is going to be affected for sure with that large intestine and the UB, and the eyes also going to be affected between the heart and the liver, right? And the UB there, okay, for sure. Okay, so this is a surprisingly versatile and quite effective formula that you can use to dispel wind dampness, open channels, and low network vessels and relieve pain. Okay, with a little extra emphasis on drying dampness and clearing the heat. So you could clear the heat with the addition of the Huang Bai there. All right, okay. We could easily stack this formula with another herb if there's deeper bone and maybe there's some tendon involvement as well. I would think of stacking this herb along with it, which would be the Xiangjiapi. Okay, Xiangjiapi. Look at that. We've got an amazing stack going on. Okay, liver, kidney, heart, liver, kidney, heart. Okay, high feng tong. Okay, but we've got, this is warming things up. Okay, so if we're warming things up here, we want to cool it down more with the Huang Bai. But it is conceivable that maybe there is a little bit more cold, or we just, or more wetness, and we just need to dispel this stuff more. And we need that acrid quality. Maybe there's just more stagnation. We need more acridity, more bitterness, huh? And even maybe it's toxic, so maybe we need to treat some of that toxin with the toxin, with the Xiangjiapi, huh? Like that. Okay. Maybe there's some kind of wet heat with swelling. Okay, so if there was wet heat with swelling, we could add this into the mix very easily. And that's one of our very common herbs. Again, is the Fuling. Okay, no real magics or surprise there, but look, it's definitely very good for supporting that kidney. Okay, also, if we have any of this rooster involvement between the lung and the kidney, Fuling could be put in there for sure. Fuling, very, very, very interesting herb. Okay, so again, the wet heat with the swelling, Huang Bai plus the Fuling, no problem. It's emphasizing the kidney aspect, but it also has a spleen aspect, which is also very strongly supported with the lung. Okay, so this is going to be kicking out that. We actually have 3 different systems here kicking out the fluid. Well, we have the kidney UB, we have the spleen system, and we have the lung system also. Okay, spleen system is interestingly supported by the heart here and the lung. Okay, lung is supported by the large intestine. Okay, so we got a lot of ways that we're cleaning the wetness and the heat at the same time, just with this addition of the Huang Bai and the Fuling. Okay, all right. So let's say that kidney heat is moving up and it's going into the back and the scapula. So it's a very specific kind of motion. What would we use? Kidney heat is going up and affecting that scapular area and that upper part of the back, okay? Okay, so we're synergizing here that UB channel, plus we're adding small intestine, okay? And that's going to be synergizing with the lung internally with the mouton. So we're adding the mouton here. So this could be swelling, like hot swelling in those, in the back, in the scapular area. Hot swelling, that happens a lot. Huang Bai plus mouton will take care of it very, very easily. Okay, we could stack this. Let's say we want to build some power in that direction. Okay, we want to emphasize that that Taiyang. What if we want to emphasize a Taiyang? How are we going to stack it? Well, let's stack it with another herb that's similar to the mouton, which is the Chumai. Okay, so now we got a good stack going on. Okay, stronger, leaning stronger toward the UB and the heart. Okay, we're stacking bitterness, we're stacking coldness. We've had the bland here from the mouton, which I didn't mention before, but it's there. Okay, but now we are emphasizing. We're emphasizing two things at once here. Actually, we're emphasizing more of a heart structure and more of a heart small intestine structure. So more of that Biao Li relationship, but also we're emphasizing more of this name relationship, this Taiyang relationship between the UB and the small intestine. So we're making that very strong in this formula. Okay, so we're building power in that direction. We could also add, we could continue in that direction, same territory, by adding just the plain old mouton. So there's different kinds of mouton. Sichuan mouton and just plain old mouton. So we're adding that as well, okay? Same tropism. So these herbs are very, very similar. Okay, again, the Chuan mouton has a little bit of the bland quality, and also has some lung going on. Okay, now, between the Chumai and the mouton, the plain mouton, right? They're both bitter. The mouton is just a little, not quite as cold. Say it's not quite as cold as the Chumai, but they got the same tropisms, even in the same order. So we can stack these to emphasize this order, okay, like that. Or if for some reason we don't want to go quite so cold, we use the mouton instead of the Chumai. Or maybe we want to go colder, so we do the Chumai instead of the mouton. Or maybe we have to really hit it even harder. We've got to start stacking this UB heart, small intestine, all of it, stacking it. So we use all of them, right? Which we can do even more strongly with the Chuan mouton as well. Okay, but that's going to bring in a little bit of lung, which is going to synergize with the UB, like that. Hopefully, this is making perfect sense. This is how we do the stacking, you guys, okay? So if this condition progresses into like a hot rash, we were treating some of that recently. This kind of condition progresses into a hot rash and maybe even bleeding on the back, maybe in the spine or the scapula. We could stack this up as well. I would add in that case some xiaoji, or sometimes it's called da xiaoji, because there's both da ji, xiaoji, and then they combine them. Oftentimes they call it da xiaoji, right? It's actually a couple of different herbs that they put together. So you have the same thing here: heart, small intestine, UB, heart, small intestine, UB, like that, plus the liver. Okay, and we had some other liver going on earlier, did we? No, not here, not in these combinations. Okay, so this is getting very strong. So if there's some blood involvement, we could add the xiaoji. Okay, this is especially like if there's a rash or any kind of a bleeding, right, in the back, the spine, the scapula, anything like that, or just the hot blood that's going into that area. Okay, now we could also use, this is an herb, I'm going to point this herb out also. Not that I don't use this herb, for one reason. because it so automatically, this really should be included in the emetic category because it makes people sick so quickly. It's the Shweyu is that charred human hair, right? Even the smell of it makes most people throw up. Okay, so you could use it theoretically, and you'd be right down the heart and kidney line. Okay, if you were in a pinch and you really had to, if you're like your plane went down in the Andes and you've got kidney heat with bleeding affecting any of these areas that we're talking about, and you really had to, and you found a plant of Huang Bai, but there was some hot bleeding that was going on in somebody who crashed in the plane as well. Oh my God, what are we going to do? Well, you could grab some hair and you could cook the hair and use that to help to stop the bleeding. Good to know. But there are a lot of other things that you could use that would probably not make people gag and throw up. Okay. How do you know if an area is bleeding internally? That's a really good question, okay? Because it's obvious when there's bleeding on the outside, but how do you know if somebody's bleeding internally, okay? And especially if it's not bleeding into the intestinal cavity or into the bladder. That's a very important thing to be able to discern because we come up with it a lot, okay? So something is bleeding internally. You could stack that scenario. In fact, I would go here first before I ever used the Shweyu probably. But just for the sake of argument, let's say that we used it. Okay. We could add the Pu Huang. So we were talking about the Pu Huang a little bit yesterday. Yes, that brings us more strongly into the kidney department, but it's also addressing the liver and the spleen as well for the bleeding. It actually combines quite well with the Shweyu because we've got the stomach and the spleen both synergized there, and you're stacking the liver as well, stacking the heart as well. Okay, doing like that. So it's kind of beautiful how all of these things go together, and even if we combine all of three of these herbs, looking at them all together, we get a really interesting territory that's highly optimized for the kidney. It looks like this. Boom. Okay. So we got a liver stack here. We got the stomach combining with the large intestine. We got UB not so much emphasized. Okay. But we've got kidney emphasized. We got it stacked here, and we got it supported here. We got it supported here in that way. Heart is supported by the spleen as well as the kidney. There's a lot of synergies going on here. Very, very beautiful. So again, synergy is what creates power in our formulas. Okay, synergy is really what creates the power. So now we're starting to really get more deeply into what do these synergies look like, because we understand all the more basic stuff. Huh? So that's what we're doing. Okay, now I'm going to add just one more here, because we're on a roll with this. We could also add, because we're talking about this heat and blood being congested. Come on. Heat and blood being congested. We could also add the Taoren. We'd add the Taoren. Okay, so it's also bitter. We're stacking up the bitter, but it also has a little sweet quality, so it's nourishing a little bit. Okay, neutral. This is a great thing about the Taoren is it's neutral, huh? But it's going through the heart and the large intestines. That takes a smack into kidney as well. Like that. Okay. If we combine it with the Pu Huang, there's a few interesting things that go on it. We've got a heart stack going on between those things. We've got a pericardium liver going on with those things. We've got a pericardium large intestine, which would, if there was stomach involvement, we would want that as well, which we could have. And if that were the case, we might even put some of that Shweyu in there. Okay. like that, okay? So we could use the Tao Ren to help to move the heat out through the Yang Ming, okay? Okay, remember the blood is a fluid pressure system, okay? So it's a fluid pressure system. So maybe after after our lunch break, Brittany can tell us all about what fluid pressure system in the lung would really mean, okay? It's all connected, okay? So it means if you relieve pressure in one area, if you relieve pressure in one area, then the pressure in the entire system is going to go down immediately. Okay? So it's a fluid system. So we have different systems in our bodies. We have a pneumatic system, we have a fluid system, we have an electrical system, we've got a chemical hormonal system. We have all these different forms of systems that are working together in our body, huh? Like that. So it's all connected. But remember, with the fluid systems, if we relieve the pressure in one area, like we use the Tao Ren, okay? So we blow the system out through the large intestine. And we blow that pressure out through the large intestine. Then the heat and the pressure everywhere is going to be relieved. Okay. I'll tell you an interesting story about that. This happened with a couple of Sifu Lai's friends. They were all into doing the very esoteric internal martial arts. These guys, they play a very, very high level with these internal martial arts. And there was one day that a couple of them, and Sifu Lai was there, and a couple of them were experimenting and trying different things with each other. And then one guy hit the other guy with his chi, and it really went through. It penetrated through his defenses. It penetrated through his Wei Qi, and it hit his lung. It hit his lung very, very strong, and they became really concerned because they knew that it was going to turn into a really serious problem if they didn't deal with it. And so this guy did the Neigong, very strong Neigong practice, to balance this hit that he took in the lung. And what happened was, about an hour later, after he did all this Neigong practice, he wound up having a very bloody bowel movement. So he transferred that hit that the lung took through the large intestine, through the Yang Ming, and he discharged the pressure. And it saved it, because that pressure probably would have invaded his heart and killed him. So it's a really, really interesting story about the pressure system in the blood. Okay, so on that note, let's go to lunch, and we'll come back in a little over an hour. All right, see you then. Bye-bye.